Thank you for joining us today on our State Technical Assistance webinar. CSN is a project supported by HRSA, and we are HRSA's primary vehicle for providing technical assistance for child and adolescent injury and violence prevention. Some technical tips as we get started. The audio is only broadcast through the phone line, so please mute your computer speakers. If you want to say anything during the call, especially during the Q&A sections, please press *pound to unmute yourself. We have today's slides at the top of our file share pod in the top of the screen. You can use chat in the chat box that will appear on the left-hand side of the screen at any time during the presentation. And the session is being recorded and will be posted to our website very shortly. So without further ado, I'd like to introduce today's presenters. My name is Maria Catratis, and I'm a co-manager of the Child Safety Learning Collaborative for the Children's Safety Network. Our first presenter today will be Karen Solis, who is a technology associate at Education Development Center. Our next presenter will be Brittany Willis, who is at the Tennessee Department of Health. And then our next group of presenters will be Ashley Cleary and Dina Liska for Nick Maniaci, who are from Children's Wisconsin. So without further ado, we'll show you our agenda. We'll be talking about website analytics and how that can help you in your IVP programs, responding to COVID-19 pandemic and moving suicide prevention to a virtual setting, and then how to use technology and injury prevention with a focus more on motor vehicle traffic safety. So without further ado, I will pass this over to Karen to talk about website analytics. Thank you so much, everyone, for joining us today.
Hello, everyone. You're probably wondering, why would a state health department want to have analytics for their website? You know, what would they be able to achieve with this information? So that's what we're going to be taking a peek to see what it can actually offer you and what you're able to assess from that information. This is a brief list of what it is that you're able to assess. Below there is a poll. Feel free to participate in this poll, but most web analytical softwares provides you with tracking and reporting information about your site traffic. Depending on the program that you use to gather this information, you may be able to assess any of the following and so much more. That includes how many views your site is receiving, how many views did a specific page or section of your site receive, how many downloads did a specific resource have over a period of time. And that can include a PDF, such as a report, an additional resource, PowerPoints, Word documents, and any other vehicles that you have on your website. Web analytics provide with much more in-depth information, so depending on which software you use and also what you're trying to achieve, you're able to get that information. So from here, from this poll, we're able to see how this which is trying to find information about the site and the location of your visitors. Moving on the screen, these are some options for web analytics. These are just a small selection. There are various paid and also free tools available to different agencies to be able to use. When considering an analytical tool, consider planning out what information you will need to gather and how it will be shared and used amongst your team. That way that will inform you as to which is the best system to actually use. In addition, speak to your IT department as they may actually already have a tool available for you. So what is Google Analytics? It is a free web analytics software offered by Google. It tracks and reports website traffic, such as how many visitors came to a page or set of pages within a select time frame, as well as demographics referring to where they came from, what region in the states, and so on. Today we're only going to be taking a small peek into what information we can quickly assess from Google Analytics. For today's example, we'll be using the Google Analytics demo account, which is available to anyone. So let's get started. This is a quick look at what Google Analytics offers out of the box. This presentation will also, as Maria mentioned, will be actually shared after this session, so you'll be able to come back and take a look at what is on this slide as to what Analytics provides you. Here we have a quick look at the top page of the quick overview report page. So this is the landing page when you access Google Analytics for your site. The key features here are the share, date, and how you want the data to display in the graph that is provided. This makes it easy for you to be able, the share feature allows you to save the report, export it as an Excel file, PDF, or Google Sheets. This makes it easy for you to be able to share countless reports with colleagues and those outside of your agency. The date range picker allows you to change the date for your time frame for the data that you're viewing. That can be by week specific, for a specific date, month, or even a year. The graph allows you to the graph area allows you to view the display in hourly, by day, week, or month. And it only controls that specific section of the report. Now let's take a look at the bottom of this report. The bottom of the report of the behavior overview page allows you to be able to see what is happening at a glance on your site. So here we're able to see that the site pages were viewed roughly 68,000 times. This is what is called the page view numbers. The site pages were viewed 40,000 unique times, which is listed under the unique page view numbers. You are able to see what was the average time spent on your pages during that period of time, as well as the rate your visitors left your site. This is demonstrated by both the bounce rate and also the exit percentage. Additionally, you are provided with some quick links to your site content, search, and the top pages for your site. So let's take a deeper look at all the pages, which is a report within Google Analytics. So here we're looking at the All Pages report. This allows you to see all of your pages. By default, it shows you the top 10, but you are able to actually extend that number to depending on how many pages you actually have within the report itself. A few notes before we discuss this report. For today, we're only focusing on page views, unique views, and entrance column. But first, let's review these columns and what they mean and represent, starting from left to right. The page title displays the title used on your site for each page. This is the page that you have assigned within your site for that specific page. The page view displays the total number of times a page was viewed. This number includes repeated views. So what does that mean? This column includes all of the times a page was viewed, regardless if it was viewed by the same person during the report's date range. For example, if visitor X viewed the shopping cart 10 times, all 10 views are counted in this column. The next column, the unique page views, displays the number of sessions a page was viewed within that session. This means although visitor X viewed your page 10 times during a specific date range, it is only counted once in this column. The entrance column, contains the number of times a visitor entered your site directly from that to that specific page. This could be a form of a bookmark from any of the browsers that they're using, an email that was submitted to them with a direct link to the page, a post on a social media such as Facebook, Twitter, and so on. Now let's take a closer look at the first row in this column. So we're going to take a look at the first row, which is the men's unisex apparel. For you, this could be your landing page, a newly released resource, or a page for a virtual event. So what does this all mean? If we look at the third column, which is the unique page views, we see that the page was viewed roughly over 3,000 times. In the second column for the page views, we see all of the views, which includes repeated views. If we compare both of these columns, we can see that this page was revisited almost 5,000 times. So that means the users within, the visitors to this site within that given period of time came back and visited that page. This is a good example of how you can use this data to assess whether or not visitors are returning to your site to view a specific resource. Lastly, the fourth column for the entrance shows us that 400 of these visitors were from visits directly, who had direct link to this page. Again, as a quick recap, for entrances, that means that if they have either bookmarked that direct link, they've clicked on an email, a link within an email, a link within a social media post, and so on. As this report displays all of your pages, what happens when you want to find a specific page? Within Google Analytics, it allows you to search within a report in order to find a specific page. So we're about to view that. So here in the same report page that we were just looking at, you're able to find the search box on top of the table located on the right side of the page. This comes in handy since most sites contain a lot of information, and chances are you're probably trying to look for a specific page. In here, in the search box, you're able to type in the direct name of the page that you are looking for. Once you have clicked on the search icon or pressed enter on your keypad, the page itself, the report, will actually refresh and show you the data just specifically for that page that you are searching for. That makes it easier to be able to find the resources that you're looking for. Now that we have covered what a behavior page provides, let's switch gears and take a look at your files, such as PDF. Google Analytics considers all call to action items such as files, external links, and other actions as events. In the events section, you will find the data for your outbound links. These are any links that point to outside of your site. So for example, for CSN, if we have a link directly to HRSA, that is considered an external link. Downloads are for any type of files, such as PDF, Word documents, and so on. Depending on the type of files and call to action items on your site, this list will vary from site to site. We are viewing the overview report for events. This report provides an at-a-glance view of how many times a group of call to action items have been clicked on. Let's take a quick look at the downloads report. This will show us what files are actually on the site and how they've been clicked on. The download report provides a list of files types you have on your site. The table will vary based on what files are posted on your site and what other actions are there. For today, we see that the site contains PDF, Word documents, and PowerPoint files. To view a specific file type, click on that file type on the table. So now we're going to take a quick look at a specific PDF file. So here we're looking at, so there is a poll available of what type of files do you have available on your website for download. While people are filling in for the poll, the PDF file download that we're using for today is the agenda file. Here we are able to see that this agenda was downloaded a total of 12 times. Let's break that number down a bit. The first column, the event label, will provide you the name of the file that you have given the file. In this instance, the file name is agenda. The third column, unique events, provides you the unique number of times the file was clicked on by a visitor. The second column, total events, provides you the total number of times the file was clicked on, this number provides repeated clicks by a visitor during that time range that you're looking at your report. Based on this report, we know that 2 visitors returned to your site to click on this file. This is useful information as it allows you to see how many times a resource is being viewed by your site's visitors. And from here, from the poll, we can see that most of the files that we all tend to utilize on a website are PDF files. Alternatively, there are many other options to be able to assess and gauge the interaction that your visitors are having with your websites. Analytics is only one method. And with that, I will turn it back to Maria.
Great. Thank you so much, Karen, for that great overview. I'd like to open it up for questions, and we did have a question in the chat, but if you would like to ask a question, you can always use the hand raise function all the way at the top of our screen, and we can call on you. But we did have a question in the chat about from Jenny. Is there any way with Google Analytics to determine how people get to your site so you determine what dissemination techniques are working best?
Sure, and I'm just going to go back to one of the first sets of slides, so bear with me because it'll be a little bit easier for me to show you in this quick little overview. So Google Analytics offers you these different out-the-box report. And to Jenny's question, that would be considered the acquisition. So this is where your visitors are coming from. This will tell you if your visitors are coming from an organic search, if they are being directed from other websites, if they are also coming from, say, for example, you have a new resource and you did a marketing campaign and you posted it on Facebook, on Twitter, it allows you to also be able to assess that information. And again, this will vary depending on the platform that you use. And for most state agencies, they may already have an analytics system available. So again, I would just encourage you to speak to your IT department to see which one it is that they actually use and how to be able to assess that information.
Great, thank you. We also got a question from Ashley in Wisconsin asking, did you create an event for the agenda data?
No. So the way how analytics, at least for Google Analytics, it treats any link on your site as an event. So it's a call to action. So if you're familiar with terminology for website, it's what we call to action. So it could be learn more about X, Y, and Z, and it treats that link as an event. So that is automatically tracked outside the system. Google Analytics does actually offer some extensive code that gets added onto websites, and you would again need to speak to your IT department that you can then add specifically to a specific resource to be able to gather all of that information just for one. But out the box, it adds it for all of your PDFs. So say, for example, in the example that we have today, and I'll go back to that page, if we had included some of the other ones that we had on this specific site, you would have been able to see, but because we were only using one example for today, you're only able to see one of the PDFs. But it does allow you to see every single file that has been clicked on. One little note, at least for Google Analytics, if a file is not found, that is a file that actually has not received a click.
Great. Can I ask a follow-up question to that? This is Jenny. So in tracking events, which would be files, it sounds like then you can also be able to track right down to individual files. So if, for example, you have a website where you're putting out information, say, for example, there's been a new law implemented around child passenger safety regulations, and you're trying to inform people, and you've got a bunch of training materials and other information that you send out, a link to a website. You can track who's coming, how they're getting there, so you can determine how they obtained that link, and then you can track the specific documents that are being downloaded by each individual who's coming to your site, and that would be with the out-of-the-box Google Analytics. Am I correct understanding?
Correct, yes. So within a file, and again, for today's session, we're only touching the real surface of Google Analytics, but even within out the box, you can actually add additional columns. So for example, for the current slide that we're showing, we would be able to ask it, okay, what was the referring path, which allows us to see how did they come from, did they come from a link internally from the site, or did they actually come from, in Jenny's example, did it come from a social media marketing account? One little note for events, as you notice, which is very different from the actual web pages. On this one, because it is a call to action, meaning it's just a link that they're clicking on, you don't get a chance to see how long a visitor actually stayed on that page, but that information is available. And I'm just going to slowly go back to a slide earlier. So I'll just leave it on this particular slide because it shows you the same information. But say, for example, if we were using Jenny's example of trying to see where somebody came from to the men's apparel, you're able to see all of this information, but again, that's only available for the page, but it's not available for the specific actual event, which is what would be your PDF file. So I just wanted to make that clear distinction between the two.
Great, thank you, Karen. Do we have any other additional questions? You can feel free to either put them in the chat or raise your hand and we'll call on you. We do have a question from our own team, Karen. We were wondering about, your own team might be accessing your website on a regular basis and clicking on different subsites or documents to download. So we were wondering if there's any way to see if your own team is clicking on it over and over again versus outside viewers.
Yep. So and again, we're speaking directly to Google Analytics. So in Google Analytics and then in the administration section, you can actually create different views of how you want to gather your data. In that section, you can have, it's recommended to have a raw data set, meaning it gives you everything that is happening on your data, on your website. And from there on, you can then create additional properties. So one could be a property specifically with the IP addresses of just whether it's your specific team, whether it's so for example for EDC, it could be for all of our different EDC offices. I know right now it's a little bit, it wouldn't necessarily mirror this since most folks are working, are telecommuting at this time, but at other moments it would be directly from our offices. Another set could be, it excludes all of your employees, all of your team members, and that allows you to be able to see who from the public side, meaning non-staff members are accessing the site, and vice versa with the other data set that's just pointing directly to your teammates and your colleagues or whoever you need to actually assess that information for, you'd be able to see that data. So depending on how you need to gather that data, it is recommended to at least leave the raw data set as is and then create specific properties for the different data that you need to pull.
Great, thank you so much. That helps clarify for us as well. Great, do we have any other questions for Karen and on Google Analytics? Oh, there's another question from Jenny asking, do you need to be on Chrome to use Google Analytics?
You do not. You do need a Google account, so that would be the only thing that you would need to be able to have access to is to create a Google account, and you can provide additional users, and you can control what they're able to see. So if you're working across various different agencies, for example, you are able to give a specific department only viewing privileges, meaning that they can come in and view reports, and then another department who you're actually more intimately working with, they'd be able to actually edit and contribute to. So you can actually provide different accounts. It doesn't need to be off of the main account, but it does require a a Gmail account.
Great, thank you so much. So we hope that we've given you some food for thought on how, as you're transitioning into more online programming and providing more information and more resources online, that you'll have a better idea of how to track this information and see what's working and what's not working for you and your team. So we'll move into a chat, and we'd like to hear from you on how you have used technology to continue your injury and violence prevention programming in response to COVID-19. And feel free to unmute yourselves and speak up. We'd love to hear from you. I see Carol Harvey in Texas is typing. Carol, would you be able to unmute and say hi? I see Jane Herway is also typing, and Jan Bright. It's good to see you all. So Jane is sharing resources through technology. Kentucky is using virtual trainings. It's great to hear. Anyone else? How have you been using technology to continue your programming or supplement your programming in response to COVID-19? We know that across the board we've had a technology revolution in some ways in response to COVID-19. And so we want to hear from you. So we have lots of virtual training in Louisiana. Anyone else? I see Rhonda Jackson in Florida was typing, and Terrence Love in Tennessee. Virtual trainings, great. Great, I'm really happy to hear, and using social media, virtual coalition meetings, this is fantastic. We're really excited to hear about all of this and to find out how this has been working for you. And to provide you with some support. So I see some more folks are typing in, so we'll let them type in. We see Steve Sparrow in Kentucky saying virtual trainings, community partnerships who share in Kentucky, virtual meetings and planning meetings. Great. I'm really happy to see all of this. We have a question. Do you have any adaptations that you've made to enable the virtual trainings to feel more in person? And you can, just as a reminder, if you want to unmute yourselves and speak, you can press *#, and you can speak up. We have some, Rhonda Jackson in Florida is saying that we have been using 211 reports to identify needs around social determinants to consider what type of messaging to target support services. And Jan Bright is sharing that for one meeting they did a chat room. Great. So it sounds like everyone has embraced technology in some way, so we'll continue on with our presentations. Jan is sharing that they use polls, breakout rooms for teamwork. That's fantastic. I'm really happy to hear about all of these innovations. And without further ado, we will hear from Brittany Willis at the Tennessee Department of Health. She's the Suicide Prevention Program Director, and she will be presenting on responding to the COVID-19 pandemic, moving suicide prevention to a virtual setting. Thank you, Brittany.
Hey.
Thanks, Maria, and thanks to the whole Children's Safety Network team for having me here today. For those of you who do not know, September is actually Suicide Prevention Month, so any chance that I can get to share our work here in Tennessee, I'm grateful for. But even now, just being able to talk to you guys and make you aware of what we're doing in Tennessee to help prevent child and youth suicide, I feel very grateful for. So who are we? We actually are part of the Child Safety Learning Collaborative team through the Children's Safety Network, and we've been doing that for several years. We were part of Cohort 1, and now we're part of Cohort 2. And these are all of our major players on that team. I also work with a statewide stakeholder task force group across the state that is a bit more comprehensive than this, but our Suicide and Self-Harm Prevention Collaborative team is really focused on ways to prevent youth suicide, and we really work with agencies across the state that can have an impact in that population. I really want to highlight here in Tennessee, we're really fortunate to have the Tennessee Suicide Prevention Network. And so we have an entire organization within our state whose sole purpose is to offer free resources, free trainings, leads to services for individuals who want to learn more about suicide and individuals who are struggling with suicide. And we really couldn't do the work that I'm about to describe to you all without their partnerships and without their collaborations. So before I really want to go in and talk to you guys about how we use data here in Tennessee, especially now in response to the COVID-19 pandemic to target our efforts, our prevention efforts, I kind of want to give you guys a picture of what mental health and suicide looks like for children and youth in Tennessee. So this is the Youth Risk Behavior Survey results from 2019 and in Tennessee. And what you'll find is 1 out of every 3 students, high school students, so this is high school age students here in Tennessee, 1 out of every 3 students, high school students in Tennessee suffer from depression and anxiety. 1 out of every 5 students have considered suicide. 1 out of every 7 students have made a plan for suicide, and actually 1 out of every 9 have attempted suicide, and then 4% of those suicide attempts resulted in medical intervention. I think that that's really important to know that this Youth Risk Behavior Survey was done a year ago, and so we already know that our children and youth are struggling with suicidal thoughts and feelings in Tennessee. But now with the COVID-19 pandemic and all the other rising risk factors across our state, we really are trying to target our prevention efforts, and that's why even more so data is important for that. Suicide is actually the 3rd leading cause of death for youth and children aged 10 to 24. And in Tennessee, 2018 was our last year for finalized death data, but we lost 39 children under the age of 18 to suicide. In fact, from 2016 to 2018, our youth between the ages of 15 to 24 experienced the highest rates of both self-harm injury. So that includes intentional self-harm, so cutting, as well as suicide attempts, as well as suicidal ideation. So those are those suicidal thoughts and feelings. And then our youth accounted for 37% of our total self-harm. So again, your intentional self-harm and your suicide attempt related emergency department visits for that same time period. So, like the rest of you across the world, across our nation, COVID-19 kind of hit in March and shut us down. And so this really shows a timeline. I think this is important when we're talking about using data to drive our target prevention efforts in response to this pandemic. We had our first confirmed case in early March, and our state was really shut down completely with stay-at-home orders by April. As of August 14th, 2020, we had a little over 170,000 confirmed cases and over 2,000 fatalities. I think it's important to note that of those, confirmed cases. Over 22,000 of those have been children aged 11 to 20, and we have had 7 deaths of children 0 to 20. I think that that's also important to note because when you think about suicide prevention, you think about mental health. Children and youth have a lot of risk factors already, but when you think about adding grief and loss to that, it really can amplify and make these children even more at risk than they already were. So actually, Vanderbilt Child Health Policy, the Center for Child Health Policy, did a poll of the Tennessee parents in June 2020 to kind of see how they were feeling and how children were feeling in response to this pandemic. I think that it's really interesting to note that 1 in 4 parents said that their own mental health has worsened, and then they reported that 1 in 7 children have worsening mental health. In addition to that, right before the pandemic hit, they also had already done a poll kind of trying to gauge how Tennessee parents feel about suicide and talking to their children and suicide. And so I wanted to kind of share this with you guys because I think it's important to think about when you're thinking about responding to the COVID-19 pandemic, especially for suicide prevention efforts and our trainings that we're going to talk about here in a little while. But more than actually 15% of parents in Tennessee feared bringing up depression and suicide, and that fear, they believe, would lead their child to think about suicide. So if you're not familiar with suicide, there is a lot of stigma around that. And so recognizing that our Tennessee parents, a large percentage of them don't even feel comfortable with talking to their children about suicide. This really shows us that now more than ever, we really need to be spreading awareness of this issue. In addition to that, about 11% of parents reported knowing the warning signs. So again, that really just shows you that now more than ever here in Tennessee, we need to be spreading awareness. And so this is where really this data piece comes in. So for those of you who have maybe heard me talk before, or those of you who are new to this, we actually here in Tennessee have a cool thing that we started about 2 years ago where we use Essence data. And Essence is a CDC database that emergency departments can report into, and it's primarily used for disease tracking. So it's used significantly for COVID-19 because it's a way to track infectious disease outbreaks. With that said, we've tailored this to be able to pull information to track suicide-related emergency department visits in children 18 and under. So I do weekly surveillance and have been prior to the COVID-19 pandemic. We've been doing this, like I said, for about 2 years. And so weekly, I go and look to see if there have been increases by county of suicide-related emergency departments in children 18 and under across our state. And those suicide-related ED visits include those for suicide attempts, intentional self-harm, and then, again, those suicidal thoughts and feelings. And we are able to target exactly which counties each week and each regions of our state are seeing increases in that behavior. And in response to that, of note, there are some limitations with this data, and I think it's really important to talk about the limitations when thinking about prevention because we try to use data-driven approaches, especially in our response to the COVID-19 pandemic. 20% of hospitals with EDs across Tennessee actually do not report into Essence. So that means that 80% of our hospitals do. And so we really feel like that still gives us a good picture of what's happening across our state. And this is for various reasons. Essence is not a database that emergency departments are required to report into. We've had several like rural hospital closings, and so it varies each year. And so be mindful of that as I talk about that. I looked at, in response to this COVID-19 pandemic, I compared ED visits from 2019 to 2020, from January to July, to kind of see if we were seeing an increase or decrease of children presenting to the ER for suicide-related behavior. And on the screen, what you'll see is we had a significant decrease in visits in comparison to 2019, right when the pandemic hit, so that March, April, May. And we really are contributing that to, people being scared to reach out or to go to the emergency department visits because of this. So we were seeing an increase, fortunately, in individuals calling the crisis line and texting the crisis text line within our state. So people were still reaching out for help, but what you're seeing is these children are in July, in comparison to 2019, there was a 3% increase. And I checked this morning, and we're about, for August, about the same as we were. But I think it's important to note that using data to target prevention efforts can be a really useful tool, because what we have done here in Tennessee is I've used this Essence data to create a rapid prevention response plan for children 18 and under. And we were already doing this, and I think that it's important to note that we were doing this before the COVID-19 pandemic hit. But this work became even more relevant and important when it hit, because it was really our only way to track how kids were feeling and our only way to be able to spread information. And so what I do is I currently notify, with that weekly surveillance, I currently notify coordinated school health coordinators across the state, our Tennessee Suicide Prevention Regional Directors, several people at the Tennessee Department of Mental Health and Substance Abuse Services, and then center staff of the exact counties that are showing increases that specific week. So we look at the week previously. So it's in almost near real time, and I share them with the counties that are seeing increases. And so in response to that, we really push our suicide and awareness and prevention materials in those counties to parents, school staff, any youth impactor that we can think of. And so some examples of things that kind of happened in response to this Essence Rapid Prevention Response Plan in March and April, when things shut down, is here in Tennessee, we were giving out breakfasts and lunches to students and to families. And so in the counties that we were seeing increases, those coordinated school health coordinators and those TSPN regional directors were actually there handing out suicide awareness materials while they were handing out lunches and talking to families, of warning signs on how to notice if their child is struggling and how to talk to their child about suicide, and to just make them aware that, children within this county are presenting more to the emergency department right now for suicide-related behavior, and to just check in. We've also seen an increase in social media, and so the coordinated school health coordinators will spread suicide prevention, the statewide crisis line number, the text line number, to the school districts and the schools that they work with. So they're being able to have direct contact with the youth who are maybe even presenting to the emergency department. And not only that, what we're finding is that many people are spreading that information to their school counselors, and the school counselors are actually reaching out to those children that are more at risk, and how and to see how they're doing. So with that said, I really want to focus on how we're using this data to spread trainings across our state. And our work with the Children's Safety Network and the Child Safety Learning Collaborative, we chose to spread, question, persuade, refer to youth impactors across the state. And our aim is to increase the number of QPR, the number of youth impactors who are trained in QPR across the state, with a specific focus on those counties and areas that have a high report of youth suicidal ideation or attempts or death. So really the biggest thing that happened in response to COVID-19 that allowed us to be able to do this work is that the QPR Institute permitted those virtual trainings. So suicide prevention and mental health can be a really, really tough topic. And so primarily up until the COVID-19 pandemic, the QPR Institute absolutely said, you know, virtual trainings were not allowed. And that's for the safety of those in the trainings. We really want to make sure that no one is triggered and that everyone walks out of the training, you know, feeling confident and comfortable and you know, not upset by the material covered. But QPR Institute did permit those virtual trainings right when the pandemic hit, so right around March and April. And the way that they did that was they converted the pre- and post-training survey forms that were normally paper forms into actual individual web links for each QPR instructor. So each QPR instructor has their own web link that they can send participants for those surveys. And they did require that a maximum of 35 participants per virtual training to create safety. But the biggest thing that I want to talk to you guys about is when you're looking at our work from January to August of 2019 to January and August 2020, what we've seen is a significant increase in the number of people that we've been able to train and the number of QPR gatekeeper trainings that we've provided. In fact, we've seen 160% increase in comparison to the January to August 2019, 160% increase in the number of QPR gatekeeper trainings that we are providing to youth impactors across the state, and we saw a 96% increase in those trained. And that's a direct result of being able to use the data from Essence and being able to target those specific counties that are showing children are really at risk. Some examples of youth impactors that we have been training are evidence-based home visiting staff because they are still making those home visits. Our CHANT, so our Community Health Access and Navigator and Tennessee staff, and those are individuals who work with families to connect them to healthcare and social support programs. Our social workers, school nurses, school teachers, and other support staff, bus drivers, and parents. And I think it's important to know also, while we do use data, and we've used a lot of data to help us target this prevention and response to COVID-19, we've really seen an increase of people recognizing that children and youth may be at risk for suicide. And so we've actually had more people reaching out as well. And so I would be interested to see if you guys are seeing that in your states as well. If you know, even if you're seeing an increase of just people wanting more information about mental health and suicide, or just any other injury prevention program that you work on. So some of our next steps is that we're going to continue to monitor suicide-related visits in children 18 years of age, and we're actually going to expand that monitoring to young adults age 18 to 24. And over the next few years, we really are looking at expanding that rapid prevention response plan and monitoring across the lifespan. We're going to continue to spread, question, persuade, refer training throughout Tennessee, and we're really going to continue to look at data to be able to target our prevention efforts in order to help save lives of children and youth across Tennessee. And there's my contact information if anyone has questions, but just thank you so much for having us.
Great. Thank you so much. We did receive a number of questions in the chat, so I would love to go through them. And if, of course, if you have any questions, you can either raise your hand or put it into the chat. The first question is from Bina Ali, and I believe that you addressed it. Bina said, I love the emphasis on using data. Have you compared suicide data from March to August 2020 with the same time period in 2019? If there were a significant increase, it may suggest that suicide is worsened. And I know that you used ED data. Do you have any data on completed suicides? Were those, have those changed over time?
So actually, so in response to COVID-19 pandemic, we've been using data in a lot of ways, and kind of one of the things that we first noticed, or kind of was like, ding, 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 we need to do this, was we did have a concern of people, an increase in suicides happening in response to this COVID-19 pandemic. As of now, and, for any of you that do work with death data, you do know, recognize that it's very, very preliminary right now. It's hard to really track that type of thing in near real time, but we're not seeing significant increases. We've actually been in collaboration with the Tennessee Department of Mental Health and Substance Abuse Services and Tennessee Suicide Prevention Network. We've actually been also doing suicide weekly reports that are sent straight to the governor from the Tennessee Department of Health, and we're tracking suicide attempts. We're using Essence data across a lifespan to see if people are presenting to the ED more, and we look at that each week, similar to what I just described to you. And then we're looking at deaths in comparison. So we're looking at 2018, 2019, and 2020. And then we're also looking at individuals who call into our statewide crisis text line, as well as those who text TN to the crisis text line. So we're really using data to monitor the situation, but as of now, and I'm going to knock on something, we're really kind of seeing a stable point in deaths and completed suicides.
That's good to hear. We have another question from Jane Herway about what do you consider an increase? Is it even one presentation or more? Or do you use the color-coded alerts in Essence? And what do you do if it's up 1 week and then down the next couple of weeks? How do you communicate to them?
So that's a really great question, Jane, and that's one of the limitations with Essence is that we do use we use the alerts within Essence. So it's a yellow alert or a red alert, and a red alert is saying, hey, there's an immediate increase, like we're seeing a significant increase in visits. But when you think about, Tennessee has 95 counties, and when you think about some of our rural counties, yes, one presentation of a child or a youth to an ED can trigger an alert. In response to Jane's question about how do we communicate, whether we see a decrease the following weeks, we actually only communicate the increases. And so it would just be very, very time consuming to look at each county across the state. I'm only one person. I would love to be able to do that. And so we don't really look at what they're doing from week to week each county, and we really focus on specific counties that are seeing increases right then, so we can use that real-time data to target those areas. I hope that answered your question.
Jane, you could unmute and respond as well. You can press *# to unmute. Maybe Jane can't unmute. Okay, There was another comment about whether your the rapid prevention response plan on use of Essence data may answer Jane's questions and if it's shareable.
Yeah, I'd be happy to share our Essence Rapid Prevention Response Plan. I think it's important to note that my position actually within the Tennessee Department of Health was created from legislation, the Suicide Prevention Act of 2018, in response to rising rates. The governor enacted the Suicide Prevention Act and created a sole position in the Tennessee Department of Health. And so I really rely on partnerships. And so I don't have any money to give those to actually do action steps. And so we really use this rapid prevention response plan as that informative piece to be able to guide our target prevention efforts. And everyone that has signed up to have some sort of role or responsibility within this response plan has done so because they have an invested interest in preventing youth suicide across our state.
Wonderful. So we'll make sure to make the connection so that you can share this information. Great. So that was a great presentation. And so we'll move into our chat on how has moving to virtual programming, for those of you who have, opened new opportunities for your child and adolescent injury and violence prevention programs. We're interested to see if you've seen any changes or any new opportunities and chances that you have to get your programming and messaging across. Terry Love in Tennessee is saying no travel, which is more efficient in ways. Terry, could you tell us a little bit more about that? If you find yourself muted, you can press *#.
Your microphone has been turned on.
Great. Jane is also saying, and Jane in Louisiana is also saying that no travel makes it more affordable for folks to attend training. The resources are more available. Oh, Terry, you can go ahead. I'm sorry I cut you off. All right. Okay, we may have lost Terry on the phone line.
I'm here now.
Oh, hey,
Hello?
Terry, how are you?
I'm sorry.
Yes, we can hear you.
It's been one of those days with me and technology. I've had trouble all day, so I need to reboot. What I was trying to say is that some people who might not travel to our meetings are now coming. Some schools who might not have scheduled a training are more open. So yeah, we're getting into some places that we wouldn't have, and then there's disadvantages too, because it's hard to be as personable and you have to really work at maintaining those relationships. But so far so good.
Great, and we have heard that from a couple of the states in the Child Safety Learning Collaborative that because they don't have to schedule an in-person meeting, they can just jump on a 20 or 30-minute Zoom call and see each other face-to-face on video and not have to travel, and it's cutting down on the lag time between the time of contact and the actual meeting. So, and we're hearing now from Jan Bright in Kentucky that this allows for more to attend from a single health department as travel cost is eliminated, and can also capture the training as a recorded webinar for registration over the year. Robin Thomas is saying that they can reach a wider audience, and Jan Bright is mentioning also able to create a webinar and offer nursing contact hours. So these are some interesting opportunities, and beyond the regular day-to-day workings and meetings and meeting with folks, we are seeing some additional opportunities to improve work that we've already been doing. So without further ado, I will pass it over to Ashley Cleary and Dina Liska from Children's Wisconsin to talk about how they've been using technology in their injury prevention programming. Thank you.
Hello everyone, my name is Ashley and I work on the injury prevention team here at Children's Wisconsin. Today I'm going to share what Children's Wisconsin has been doing to serve families during COVID-19. In early April, we implemented virtual car seat appointments, otherwise known as video visits. A video visit is an appointment using live video to provide car seat education and installation support to caregivers. Appointments usually take about 60 minutes to make sure that there's enough time to cover installation, harnessing, and caregiver questions. There's a variety of platforms that you can use to do video visits depending on what works best for you and your organization. Our organization uses Zoom technology because it works best with what our hospital has already implemented with our electronic health record. Other platforms CPSTs have been using include FaceTime, Google Hangout, and Skype. American Family Children's Hospital in Madison uses Google Hangout and Skype for their video visits. Again, there's no right or wrong platform for video visits, it's just what works best for you and your organization. Now I'm going to share the supplies we've been using for our appointments. We have a car seat, a demo doll, towel, pool noodle, latch manual, vehicle or vehicle bench seat, receiving blankets, a car seat, of course, and the car seat and vehicle owner's manual. We also have created a form for documentation that I'll get into in a little bit. When we first rolled out our video visits, we were working from home, so we didn't have a bench seat or pool noodle or latch manual. So we improvised by using our vehicle seats, just by taking our phones out to our cars. We also looked up the car seat and the vehicle manuals on the internet before the appointment. We learned appointments went smoother when we had the same or similar car seat as the family. Obviously, we don't have every car seat on the market in our office, so this can be challenging. You'll figure out what supplies works best for you. The photo on the right is our first video visit back in the office, so there's Nick on the screen, and then you can kind of see our wow cart. We have a wow cart, which is a computer or workstation on wheels. It has a webcam that can be moved around and zoomed in on the car seat. Currently, we use one technician in the office and then a second technician at home to make sure everything is clear on the caregiver end. When scheduling appointments, we collect caregiver contact information, child's age, height, weight, car seat, and vehicle information. Collecting this beforehand allows the CPST to look up the car seat and the vehicle manuals prior to the appointment. Not every appointment were we able to collect all this information beforehand. However, the more information we knew before each appointment, the smoother it went. After the caregiver schedules the appointment, they receive an email with the Zoom link and other important instructions for their video visit. At the start of the video visit, the CPST does an introduction, explains the visit to the caregiver. Next, the CPST completes the documentation form. An example of our form is on the right. We decided to create our own form, but you can certainly use the Safe Kids or digital checklist form for these visits. Then we share our screen with caregivers to show them the release. Because of COVID, we were able to get our legal team to approve a verbal consent. Eventually, we'll need to get an actual signature of caregivers consenting to the service. Lastly, the CPST verifies the car seat information, demonstrates installation and harnessing, and they wrap up with appointment questions that the caregivers might have. After the visit, the caregiver receives an email with a teaching sheet on the right, the survey link, and any questions that the CPST needed to follow up on. We conducted a PDSA cycle for the implementation phase of these video visits. We quickly learned that we needed to tell caregivers to have a charged phone battery or device battery for the appointment, and for better connection, it helps to take the device off of Wi-Fi. We also have found that vehicles parked outside have better lighting than a vehicle parked in a garage. Through the visits and the surveys, we have received positive feedback from caregivers on offering video visits. This is just an example of the process we use for video visits. To get you thinking, Safe Kids and Safe Ride News also has resources available to help you create a virtual car seat program. In addition to our virtual car seat appointments, we have also implemented curbside pickup for car seat distribution. This was implemented in early July, where families can come to our office to pick up car seats. We had a 100% show rate for the first month of July. This is huge because our regular no-show rate is closer to 45%. We hoped that curbside appointments would lead to video visits, but that hasn't always been the case, so work in progress currently. We have pivoted along the implementation process by conducting small changes through PDSA cycles. We conducted a PDSA cycle on parent wayfinding or caregiver wayfinding to find the specific parking lot. We actually had a TA call with Jenny, and she recommended that we get a colorful object to help parents find the parking lot. We thought of everything. We thought of balloons to signs, but we settled on this flag, which you can see on the right. And this week I do want to report that we've had a 100% show rate and 100% finding the correct parking lot, which is huge. We have also learned a lot from this process, and some things we learned we will leverage when we go back to doing somewhat of an in-person appointment. Now my coworker, Dina, is going to present on a state CPS call that we had this summer.
Thanks, Ashley. I'm Dina Liska. I'm a child passenger safety instructor with Children's Wisconsin. Nick is the coordinator for our Child Passenger Safety Wisconsin program, and I'm filling in because he was asked to do live TV during this same time frame. So I think I have the better deal here. So I'm going to share his slides on using technology to engage child passenger safety technicians and instructors. A few weeks after we moved into the shutdown, we met with our Learning Collaborative colleagues to see what they were doing about continuing to provide child passenger safety services to families. From that meeting, Nick realized there was a need for a larger conversation about child passenger safety and how we would pivot. So in the past, child passenger safety technicians would typically come together once or twice a year at the governor's conference, our child passenger safety conference. So what Nick did was schedule a call to further open the communication lines between technicians. Participants were encouraged to share their video. They were using polling options in the Zoom, and the goal was to engage the technicians in active conversation. Feedback from the call was positive, including an increased engagement and interaction between technicians, and appreciation for the updates and the new ways that agencies were working to provide car seat services and car seat checks during COVID-19. The call was recorded, and it was sent out to all the technicians in the state, and 72 technicians attended on the actual call live. So with that success, Nick scheduled a virtual state instructor meeting also. So these would be the instructors who teach the child passenger safety technicians. And previously we had held one, sometimes a couple of meetings per year with those instructors in person. And due to COVID-19, we decided to host a virtual call. So like the technician meeting, Nick used Zoom and the polling option to engage participants in active conversation. The instructors enjoyed hearing about updates. Many questions were answered about how we will keep CPSTs certified, about options for courses, and training new technicians. So overall, the feedback was very good for the instructor meeting. 30 out of our 40 instructors in the state attended the call, and it was also recorded and sent to all instructors via email. So what will continue after COVID-19 as a result of some of the things we've learned? Virtual car seat checks will continue. Curbside pickup of low-cost car seats is something that we are piloting and exploring. And yearly and quarterly meetings of the child passenger safety technicians and instructors will continue to keep everyone more engaged and informed around the topic of child passenger safety. Overall, our motor vehicle traffic safety team sees this as an opportunity. What we've learned in just a couple short months is that these options use resources that we already had or that were easy for us and our families and partners to access. These are also things that we can continue even when in-person services return. So we're not spending time developing things that are single-use or a small platform. We also learned that many strategies actually can help us to reach some of our families better than in-person services can. And I think this is also helping us to open our minds to other parts of our programs and other activities and how we might think differently about how we deliver services to families. So overall, this has been a great opportunity for us to learn how we serve our families and how we deliver our services. Thank you.
Great, thank you. We had a couple of questions in the chat, and I know that Ashley has been busy answering them, but I want to make sure that we hear them as well. So one of the questions was, could you please clarify what you mean by one person in the home for your video visits? Does that mean you have someone in person in addition to the person who's online?
No, so we actually have one staff member using that WOW cart in the office and then another staff member at their home because we can't really have that many people in the office at the same time. So we have our two staff members distant from each other, and then we have a third person, the family, on the video visit. So there would be 3 people on the Zoom call.
Okay, great. And so they're all in different locations. That's what you mean.
Correct.
One person has
Yep.
the cart. Okay. Okay. And then there was another question about the virtual meetings, if they're recorded and shared with families for later viewing. So
The
the
video
actual,
visits are not recorded.
Yeah, the video. Okay.
And that's probably because of HIPAA. We would have to get like another consent signed to get the parents to release it. And then the state CPST call was recorded and sent out to all the CPSTs in the state.
Great. All right. Does anyone else have any questions for Ashley and Dina in Children's Wisconsin? You can feel free to enter anything in the chat or raise your hand and we'll call on you. You are unmuted, so if you'd like to just speak up, you can go ahead.
Hi, this is Jane in Louisiana. Can you guys hear me?
Yes, we can. Hi, Jane.
Hey, you guys, for those of you that work in the child passenger safety space, I have a question about the science and engineering and what are the conversations in the manufacturing world about making car seats friendlier and easier to install and less prone to so many missteps in the installation. When I think about like all the training that the technicians need to go through, and just sometimes in our community too, there are barriers just by the level and the amount of training that's needed by law enforcement or other folks that become techs, and then just with families, you know, is the science and engineering working to make it so it's not so difficult for people to safely, you know, seat their children in cars?
Does anyone have a response?
You know, just think about all the years that we've been doing this and just how hard it is and how important the installation techs are. And, you know, I was just thinking when you guys were talking about how, yeah, we can't have a copy of every car seat that parents could possibly have and caregivers possibly could have. You know, it just almost seems like this is a place where engineering could be our friend and somehow figuring out a way to make this easy. And I was just wondering if there were conversations or, in your world around sort of these solutions, like engineering solutions. When we think about like all the different state strategic highway safety plans, and there's impaired driving, distracted driving, passenger safety, and then there's the engineering that just makes roadways so much safer and vehicles so much safer. I'm just wondering if there are any conversations about making the car seat much easier and foolproof, I should say.
Jane, this is Jenny. That's a really great question. It looks like Ashley might have had to pop off. I know she had another competing event. Perhaps, Dina, you could take that back to your child passenger safety facet of the MBTS team and see if they have any information, and I will happily reach out to our other participating members across the Child Safety Learning Collaborative that are working on motor vehicle traffic safety, and reach out to some of our motor vehicle traffic safety partners to see if I can get any information on that and share it out.
Yeah, I know last year at Safe States, the representative, I can't remember his name right now, but from Juvenile Product Manufacturers Association was there. I'm wondering if that would be the group that would know something about, what's being tested and things like that around car seats or even Safe Kids, kind of thing.
Yeah, it looks like Dina has a response. Dina?
Oh, good. Thanks, Dina.
Hey, I was kind of waiting to see if any other technicians or instructors would weigh in because I know there's some others on the call. That is always one of the issues that we're dealing with as technicians because there are so many different types of car seats and cars and infinite numbers of combinations of those things. So what you see is that the technology takes a long time to get to market and then takes a long time to get into the hands of families. But if you think about the lower anchors and tether for children, latch, a lot of families still don't realize that it exists or know how to use it, but it's been in vehicles for a long time now. And so that was one effort to try to standardize some of the installation and make it easier for families. And it didn't wind up being quite the solve all that people were hoping for. So I think there's room for continued conversations with manufacturers. And that's something that routinely happens between manufacturers and technicians at some of the state and national conferences and events that invite both to the table just for that purpose.
Cool. I think that's great that they come together, and they can, the folks that are at the front lines who are struggling with families to get them, you know what I mean? Like you guys hear it from families on what are some of the challenges and everything to be able to have the ear of the designers and the engineers who are working to help you guys solve this problem. So that's great. Thanks, Dina.
Sure.
Great, thank you. Are there any other questions for Dina and Ashley? Anything about what they've been working on? All right. Well, I really would like to thank all of you, all of the presenters today, Karen and Brittany, Ashley, and Dina, for this really great combination of presentations of what we can do to track our work online, what types of innovations we're doing in response to COVID-19, what improvements we're making to our work from prior to COVID-19, and what we're hoping to continue using technology after the pandemic is over. We're really happy that you are all able to join us today, and we hope that you've gotten a lot out of this presentation. The slides are at the on the top left corner in the file share pod, and you should have seen our evaluation pod open up. We are always looking for feedback about our state technical assistance webinars, and we hope to improve what we're doing for you in future calls. Jenny has also entered our technical assistance request form in the chat pod. We are Really looking forward to helping you with any technical assistance at any time. So you can complete that form and it'll come to us, and we'll definitely respond to you and get back to you with it. But you can check out our website. We have a ton of resources on different topics, and we hope to hear from you soon. Thank you all for joining us today, and thank you again to all of our presenters. We really appreciate your time and effort in sharing all of your wonderful work with us today. Thank you so much, everyone.